Hi, I'm Harmanpreet Kaur, a nurse, and I'm working today with my buddy nurses within the community mental health team. I'm submitting a handover of Trevor, a 48-year-old male who has been referred to the community mental health clinic by his general practitioner to further psychiatric examination and management. Situation. Over the last several months, Trevor had been exhibiting increasing signs and symptoms of depression. In his evaluation, he talked about sadness and hopelessness, lack of interest in activities he once enjoyed, like swimming and camping, and lack of motivation. Trevor also said that he did not feel as much enjoyment or engagement when playing, studying at work, or with family. It was concerning to learn of Trevor's thoughts of suicide, which he said he has at least once a day. When asked what keeps him from taking any action on these thoughts, he replied, talking to you. Additionally, Trevor admitted that he had tried to commit suicide a while ago, suggesting that he has heightened risk for suicide and needed urgent evaluation and intervention. Trevor's primary mental health issue is worsening of his major depression, with worsening ideation into thoughts of suicide and hopelessness. Background. Trevor is known to have MDD and is currently prescribed an oral antidepressant drug. He also had high blood pressure and is taking blood pressure pills. There is no mention of any current alcohol or substance use. However, continued assessment would be required to exclude the possibility that alcohol or drug use contributed to his presentation. Having a wife and two daughters appeared to be a protective factor for Trevor. Despite trying to find comfort and support for his family, Trevor is feeling emotionally disconnected and unable to enjoy himself or feel at ease with activities that once brought him meaning. Loss of interest, social withdrawal, and hopelessness are indicative of depressive relapse and functional decline. These can be psychological factors such as lower coping ability, lower levels of satisfaction at work, and emotional burden. From chronic depression, it is important to be aware of the strengths, supports, and life experience of the person when working in recovery led mental health practice to create care plans. Assessment. Mental state examination MSC. Appearance. During the interaction, Trevor appeared to be tired and withdrawn. He exhibited reduced emotional energy and eye contact, both of which have been associated with depressive disorders. Behavior. Trevor was cooperative but showed psychomotor retardation and slow engagement. He looked to be feeling downhearted and helpless throughout the discussion. Speech. His speech was quiet, slow, and less spontaneous, reflecting depressive symptoms. Answers to questions were succinct but relevant. Affect. Taylor demonstrated a flat and restricted affect, congruent with his expressed low mood and hopelessness. Thought. Trevor had thoughts of hopelessness and helplessness and a recurring thought of suicide. He has spoken of suicidal ideations every day and told us of previous suicide attempt. These thoughts point towards suicidal ideation and are serious signs of thinking. The Mental Health Commission states that suicidal ideation plus hopelessness and previous attempts leads to risk assessment. Risk of suicide, self-harm. Trevor's risk of suicide is considered high because he has daily suicidal thoughts, previous suicide attempt, feeling of hopelessness and disability and isolation. Suicide-related behavior is most strongly predicted by past suicide attempts. Trevor's response of talking to you means that he does not have some of the protective factors that may be impulsive in the event of an increase in stress. There is a twofold increased risk of worsening mental health problems. The chance of any further deterioration in mental health is twofold. The depression symptoms continue and are accompanied by a lack of motivation, decreased activities, and dysfunctional coping, which all put Trevor at a greater risk for his depression getting worse. If left untreated, it can be impact work, social and family relationships, drug compliance, and health. Depression significantly impacts well-being and is risk factor for burden of chronic diseases and reduced quality of life. Recommendation. The first suggestive nursing intervention is a collaborative plan of care for Trevor's suicide risk. A recovery oriented approach involves working with Trevor to explore triggers, coping emergency contexts, and protective supports, including his wife and daughters. Safety planning has been proven to decrease suicidal behaviors and increase hope and empowerment. Secondly, it is recommended to engage in therapeutic interactions and to review, often with mental health practitioners, to reduce the risk of retardation or deterioration. By creating a therapeutic alliance based on trust, therapeutic Trevor is able to share decisions about treatment objectives as well as express emotions without fear. Slowly resuming meaningful activities and can help to enhance mood and recovery. Alongside medication review, referral to psychological therapies, example cognitive behavioral therapy, may be considered. In terms of legislation, the pertinent Mental Health Act should be taken into account. When Trevor's suicide risk increases and can no longer keep himself safe, the definition of involuntary assessment under the New South Wales Mental Health Act 2007 is that a person must be assessed involuntarily if they're mentally ill and deemed to be at significant risk of harm to themselves or others. Trevor is currently cooperative, communicative, and agreeable with clinicians. So it is hardly surprising that the least restrictive and recovery orientated would be voluntary treatment and ongoing community support. Finally, and at last, Trevor is a young man who has been growing major depression symptoms and at is high risk for suicide, who requires immediate therapeutic interventions, collaborative safety planning, monitoring of risks, and a comprehensive mental health care team. Thank you. So, this is the handover of Trevor, who is a 48-year-old male.